Welcome back to the Private Parts of Wellness, where we will be unzipping our lab coats and saying things your OBGYN mumbles, your GP skips, and your HR department definitely doesn't want you to bring up. My name is Jessica. I'm your hormone-savvy, anti-perfectionist nurse practitioner. And today we're diving deep into a word that sounds clinical, boring, for some people dangerous, and for others, kind of gross. We're talking about cholesterol. But stick with me because cholesterol is juicy. It can be kind of horny. And it's holding up your hormones, your brain, your identity, and maybe even your orgasms. And yes, I'll also be talking about FUPAs. This podcast is for educational purposes only. Not medical advice. I'm not your provider unless we've done the paperwork and talked about hormones over Zoom. So don't use this episode to self-diagnose, change your meds, or pick a fight with your provider. Talk to your healthcare team. Cool. Thank you. So a week ago or so, doesn't matter, I was at work and I was reading labs out loud. No names. The person I was talking to was completely anonymous, well, confidential, and you don't have to think about like a HIPAA high horse, because I am always about the HIPAA. Anyway, I was on the phone, I was talking about labs, and I casually mentioned triglycerides as a part of this person's cholesterol panel. Well, after enter a Virgo in Scrubs, who, if you know anything about astrology, they're very detail-oriented, which is just lovely. And they reached out and said to me, you'd want me to correct you if you said something wrong, right? And I thought, yeah, because I do. Technically, I do. I do always want to keep learning. And they immediately started to remind me that technically triglycerides are lipids and not cholesterol. But of course, I was talking to a human being and not a robot. So sometimes you have to say cholesterol to talk about the whole fat family. And then as a result, this smug moment sent me down a rabbit hole that led to hormones, gender, race, aging, desire, and what happens when we run low on estrogen, but still want to get laid. So I thought we'd start with Lipids 101. Hopefully at the end of this, which I might have said already, you will have an idea of what's going on when you go to the doctor or your provider and you talk about your cholesterol and how to understand it yourself a little bit more. So lipids. Lipids are fat. And they break down when we talk about the fat, the lipids within your body in a couple ways. The first one are triglycerides. So triglycerides are sugar's final form, and they can spike with stress, alcohol, perimenopause, gummy bears, and they're not evil. Triglycerides are just reactive to what's being brought in to the system. Then there are phospholipids, and we can think about cellular skin. I think a lot of times when I hear the word phospholipids, I'm thinking about some of the newest creams and lotions and potions for skin, but they hold cells together very much like a good face oil. And essentially, they are the behind the scenes part of the lipid panel or the lipid profile. Then we've got fatty acids, and we can think about fatty acids in the sense of omega-3 fatty acids, fish, eat good fatty fish, that sort of thing. And they influence inflammation, mood, memory, and everything from your skin to your actual brain. And even with those fatty acids, because there's 3, 6, and 9 when we're thinking of omega, which are maybe the most famous ones. 3 is the one that really helps with inflammation, and 6 can make inflammation elevate, if that makes sense. And finally, there are sterols. And we think about the word cholesterol. Cholesterol. Anyway, the hormone-making, brain-lubing, identity-defining queens of the lipid world. So what does cholesterol actually mean? Cholesterol is 3 parts, and chole, meaning bile, and you can think of your gallbladder and bile, like if you're puking bile. But anyway, you can think of your gallbladder. Sterols are solid. So chole, steros equals solid, and all, OL, alcohol. So cholesterol literally means solid bile alcohol. These, remember how we talked about bile and gallbladder? These were actually discovered in gallstones. But don't be fooled. Cholesterol is actually like the most important part of your hormones. So even though it's part of that lipid profile, it really does a lot more. And we reduce it down to good cholesterol, bad cholesterol, but it's actually kind of the MVP of hormones and your brain and obviously your sex life. And cholesterol is very, very misunderstood because she's essential and she's hot and she's just, we always want to dismiss her and get rid of her. Anyway, little judgment. Anyway, so sterols, they actually do make hormones. So let's kind of dive into that a little bit. Your body takes cholesterol and it turns it into something called pregnenolone. And that is the mother hormone. From pregnenolone, we get progesterone, which is calming. It helps us with sleep. It helps us with mood. We also get DHEA. It's a shorter form of a hormone that you make in the adrenals. And it is a precursor of testosterone and estrogen. In fact, DHEA will primarily, for most folks, turn into a very weaker form of testosterone, and then it'll kind of morph into estrogen. Testosterone, so right, we get the pregnenolone, progesterone, DHEA, and testosterone as well. Testosterone, when we think about testosterone, we're talking about libido, drive, muscle, and even presence. And finally, estrogen. So here we've got moisture, memory, curves, and blood flow. And then there's one other hormone that we don't really think about so much when we think about the cholesterol into hormones, but it is prolactin. And that can totally mess with your cholesterol as well as your sex drive. And we're going to get into that in a second. So let's take a second and talk about, all right, so let's break down what we're talking about when we're talking about a standard lipid panel or a basic lipid panel. The first thing you're going to see is would be total cholesterol. And this is a sum of your HDL, which we're going to talk about in a second, LDL, things you've heard of, and a portion of your triglycerides. Think about 20% of your triglycerides. And over 200, so a number of over 200 for total cholesterol may raise some eyebrows, but alone it tells you almost nothing. In fact, it's like seeing a grocery bill without knowing what's actually in the bag. So you get the idea. So HDL is high density lipoprotein. And again, lipoprotein, so protein, fat, protein. And it's kind of as if it's the janitor crew in your blood, and it sweeps up the excess cholesterol and returns it to the liver. And more is better. Over 60 on that number is ideal. So this is why it's usually called good cholesterol. Estrogen will boost this HDL, this high density lipoprotein. And so you may notice if you are going through menopause, whether it is surgical, natural, chemical, whatever that is for you, that number, that HDL will start to drop. LDL stands for low density lipoprotein. So where HDL is like the janitor crew coming in and environmental services cleaning up, LDL are delivery trucks with different types of low density lipoproteins. So it's not evil, but if they oxidize, these are just terms to know in your head, oxidize or start to pile up, they will block traffic and cause plaque. Now, you've got fluffy LDL, and you can think of like friendly clouds, just floating, or small, dense LDL. And you can think of those as like gremlin particles that wedge into your arteries and really start to cause problems. And you can ask your provider for particle size if your LDL is high. And they give some suggestions of tests that you may want to discuss with your provider. Again, we come back to that whole triglycerides. So that's the sugar, fat, leftovers. So this is what your body makes when it stores excess energy from sugar and carbs. Remember, we need sugar and we need carbs. I'm not saying that you need a pint of ice cream, although I used to tell people at one point in my life that I had these boyfriends, Ben and Jerry, that would come and bring me something every night, something new and refreshing. I'm not talking about that, but there are sugar and carbs in almost all the foods that you eat, the vegetable, fruit, proteins. There are sugars and carbs there. So I'm not talking about the additional sugars and carbs, but we need them for energy. And this triglyceride, which is the sugar, fat, leftovers, right? What the body stores after there's excess, when there's excess, the triglycerides will again spike. You may notice a spike in perimenopause. So where the numbers were fine and great and normal, all of a sudden you've got high cholesterol, or you've got your lipid panel is out of the norm. So it can happen with perimenopause. It can also happen with stress. Alcohol, of course, because those are like excess sugars that you probably don't need and your body can't really work with. And then insulin resistance is something that you may be experiencing. Again, can be tied again through changes in life, aging, dietary issues, stress. You get the idea. And for the triglycerides, we want to aim for under 150. So what is normal-ish? I've given you some numbers. So HDL, you want over 60, ideally. LDL, under 100. But again, context matters. Triglycerides, under 150. And the total cholesterol, over 200. No, you kind of want it to be under 200, but if it is over 200, does it mean that you're doomed and in line for a heart attack? No. It means that we need to figure out what's behind that number, right? Because it's the receipt and what's in the bag. So most providers, or not most, but a lot of providers will stop at that kind of basic panel and say like, okay, well, work on this, change your diet. Maybe we need to consider lipids. We need to consider medicine. But you're not most patients. So you're not going to stop just there, right? You're going to be annoying in the best way. You're going to be asking for a couple extra things just to get a full picture if your numbers are one way or the other and out of range. Or even if you've got a provider where you're working really well collaboratively and you're kind of on the borderline of either way, these might be some additional labs you'd be interested in asking for. So the first one is lipoprotein A. So A, it's a sticky, genetically inherited LDL, so low density lipid. And when that number is on the higher level, it increases your risk, even if everything else looks good. And that's where it's something that can't be fixed with kale. It's not that you've done anything wrong. You haven't lived the wrong life. It's just kind of where you're at genetically. Then there's a protein B, lipoprotein B, ApoB, it can be called, and that counts the number of plaque-making particles. So you can kind of think of that as more trucks equals more risk. So those are two lab tests that if you've got a higher LDL, you want to possibly start to look into these other tests. Then there's CRP, HSCRP. So this is an inflammation check. So if your body's on fire inside, we want to know if you're inflamed. Years ago, and I think I've mentioned this in other podcasts, years ago, I came across, I don't even know if my mom gave it to me. This was before AARP was harassing me on their annual schedule as they do now. So I must have been like earlier 40s. And I was given this article about inflammation. And it was a really great article. I probably have it in one of my piles where it talked about inflammation as a risk factor for cardiovascular problems, so heart issues, cancer, disease in general, and just not aging well. So that's where that CRP comes in. The other thing you might want to look into, if we're looking at a full picture and you're noticing that these cholesterol levels are high, and now you know that cholesterol helps to inform our hormones, is something called an SHBG. That stands for sex hormone binding globulin. So if you're on or thinking about gender affirming hormone care, and remember, I consider all hormone care to be gender affirming, whether you are a menopausal female or a middle-aged or older man who takes HRT hormones to make them more womanly, manly, or through the whole spectrum, right? Our trans friends, our non-binary friends, it's all gender affirming care. Anyway, so again, if you're on or thinking about HRT, SHBG shows you how much of your hormone is actually usable, because it is a binding globulin. It's a protein that hormones will bind to. Prolactin, prolactation, yep, it's a milk hormone, and too much of it, and we're not talking about when you are actually lactating, right? But too much prolactin can mess with your lipids, your mood, and your libido. And it can be elevated from a couple different things. It can be elevated from stress, again, with the stress. It can be elevated from antidepressants, antipsychotics, and from cannabis. If you are a heavy cannabis imbiber, it can lift your prolactin, and all of a sudden your lipids are fucked with, and you are not down to fuck because your libido is fucked with too. And by the way, probably too late to tell you I cursed. Finally, last test would be a CAC, and that's a coronary artery calcium score. And this is a scan that shows actual plaque in your arteries. And a score of 0 means you're good, right? And even if your LDL is high, but your score is 0, that's the context that we're talking about. Now, caveat with this exam is that it's usually not covered by your insurance. Now, I'm sure that there are cases that it is covered, but for most folks, it's not covered. So we're thinking it's about here where I am, about a $130 out-of-pocket investment, but it is well worth it. And you would do it once every 3 years or so if something was indicating the need for this kind of scan. And it gives a fuller picture of what's happening. Because your labs are not your mortality. They are data points and not your destiny. I think so many times we see these numbers and we start to flip out and we freak out. So this just all gives more information to paint the picture. So I want to talk specifically about hormones. As I said a second ago, hormone care in the idea of HRT or gender is all gender affirming care. So the other thing to know is that all human beings have the same hormones. We just have them in different percentages, levels, different kind of prominence at different parts of our lives. So just like hormones are for everyone, so are lipids, fats. Hormones don't just shift moods, they shift your whole lipid profile. So let's start first with a cis woman on HRT. If you don't know what I mean by cisgendered women or cisgendered this person or cisgendered that person, it means that somebody is born female assigned at birth. That's the kind of official language around sex and gender, and they live their lives as girls. They feel that they are girls, and they become women. So cisgendered, male, female, you got the idea, right? So when we're thinking about cisgendered women on HRT, I am one of them. We're thinking about juicy vaginas, better sleep, orgasms that say, "Ooh, the girl's back." And the lipids usually react positively. The high density lipids go up, the low density lipids go down, as well as the triglycerides. Now, for trans women, so that are on hormone care, right? Because we're not going to get into that, but let's just talk about trans women who are on hormonal care. They're usually taking estrogen, right? And an anti-androgen. They're usually taking estrogen plus an anti-androgen, something to lower the testosterone. And so for them, they're going to have more curves. Their skin is going to glow. They're going to have deeper emotional access. And again, don't come at me for that was not my experience. It's fine, right? We're broad strokes we're painting here. But the lipid shift is a little bit different. For trans women, the low density lipids will go down, but the triglycerides may go up. And sometimes the high density lipids will go down as well. For trans men, so these are people who are taking very large amounts of testosterone to have their gender align with more masculine presenting profile. I can't think of the word, but they're going to see a change in their hair, meaning they may lose some hair. grow some hair, lose some hair on the top of their head, grow some hair on their bodies, or lots of hair on their bodies. The voice will drop and the libido will increase. For them, the lipids will change where the high density lipids will go down. Sometimes those low density lipids and triglycerides will go up, and especially early on. What is seen for a lot of trans men is that as time carries on, that will start to level out. For cis men, so we're talking about boys who become men and have, kind of the you get it. I explained it. And for cis men who are doing testosterone care, they'll find that they will have better recall for words in particular, more muscle, loss of body fat, and even like a little more swagger to them. Libido will increase, but for their lipids, high density lipids will go down, low density and triglycerides will go up. And at certain points, for some cis men, they will go experience something called aromatization. And aromatization is where, if you think back or a little bit earlier when I was talking about DHEA, I was telling you how testosterone will then turn into estrogen. So for some I keep saying trans men, for some cis men, they will actually be feeling great on testosterone. And you know what? Honestly, this can probably happen for trans men as well, but we're talking about cis men here. They'll be taking their testosterone, feeling incredible, and then all of a sudden they start to notice they have more belly fat. They start to notice they have chest fat. They start to notice that they are a little more sensitive to things. And that is that shift where the testosterone will convert into estrogen. But here's the other interesting fact or info for our non-binary folks, because sometimes gender non-conforming, non-binary people will choose to take hormones. And this becomes a very customized, tailored plan for their particular needs and where they feel most comfortable. And there we can't say that the lipid profile is going to perform one way or not. As they tailor their gender affirming care, they'll notice that there's probably a shift that is also equal to that, dialed into that specific personalized medication protocol. Does that make sense? But the lipid facts are that gender affirming hormone therapy for all people may change your lipid profile when we're talking about triglycerides, HDL, LDL. And we want to track those trends and not, we're tracking it and we're not finding perfection necessarily, right? But we're tracking it and we're making adjustments to, so you can live your best life. I had mentioned I want to talk about FUPAs because I do. I like to talk about FUPAs. What's a FUPA? Do you know what a FUPA is? A FUPA is in polite society, we would say fatty upper pubic area. And you can change that P to anything that works for you. All people can have a FUPA, and it might reflect that you have, and you could have a FUPA light, right? It might reflect that you have a drop in your estrogen. It might reflect that your cortisol is a little bit higher, that you've got some insulin resistance, or trauma. Or it could just be the reflection of your soft, sacred landing pad. Sometimes a reduction in the FUPA is all you need to make your eggplant look bigger, or your clit. Not really. I mean, because clit's covered by a hood. But anyway, you get the idea. And sometimes your FUPA is there to just keep things warm and protected. Either way, if you've noticed it, I want you to know it. I want you to love it. I want you to understand that it is telling you something, right? And what that something is really up to you. I'd mentioned some cholesterol medication, and I'm not going to get into those medicines, but I do want to talk a little bit about intersectionality and cholesterol blame, specifically for Black, brown, and fat folks. Because a lot of times, Black, brown, and fat folks are overprescribed statins. Just like some queer folks and trans folks are denied hormones or dismissed. Fat is blamed most often for what may be hormonal, may be inherited, or protective. So please know that fat stores estrogen. Fat can store power, and it does actually store power. Fat stores estrogen. Fat stores power. And that cholesterol isn't evil. It is contextual. So instead of letting the system, the word that's coming up for me is gaslight you into silence or statins, like throwing a pill at something. What if you build a space where you can collaborate with your provider and discuss all of this? So that's what I hope that we've done here today. And I'm not saying that you shouldn't be on medicine. Not at all. Not at all. What I am saying is that sometimes we all try and find the quickest, shortest answer. And sometimes things are a little more nuanced. And sometimes it's not throw a pill or change your diet. Sometimes it's managing stress or understanding the stage that you're in. Okay, so I hope this helps. And I hope you found this super valuable. If you want to create space with friends or your people, you may be interested in creating your own radical pause salon. Think of it as tea, tequila, estrogen, testosterone, and education. You bring your people, you book me, or schedule a private session to decode your information and have all of your questions answered, or most of them, and create your own pleasure, a blueprint. Please like, subscribe, share, comment. It really helps me. It helps other people learn about what we're doing here. You can also join me on Discord. It's a new space that I'm using, and we're slowly building. And if you look on the Discord, you can find me on as the Menopause Anarchist. That's the page. I think that's how that works. I'm just learning it myself. And there you've got a space to share your thoughts, your ideas, your tips, because you're not the only one who's confused, horny, tired, or hot flashing your way to truth. All right, so that's that. I hope this episode brought you some clarity and at least took a little bit of the pressure off. Finally, you can follow me on Instagram at Private Parts of Wellness. Again, leave a review, leave a comment. And if you show me proof of said review and comment, I will send you my easy, no bullshit guide to understanding your labs. Well, specifically your lipid labs. It's short, it's sassy, it'll make you smarter than your portal, and you can bring it and talk to your provider. Again, that's it. Thanks again. Remember, everything I've said here is just for entertainment purposes. Although I'm an NP, I am not your NP. Please talk to your team about any changes that are going through your mind. Do not make any changes without talking to your team. Okay, I'm really, really done now. Stay curious, stay juicy, stay messy, stay squishy. Bye for now.